Welcome to another episode of Social Network. My name is Amanda Mkhize. Every week we feature the latest CSI news, game changers, organizations, and people who are changing lives. Let's go straight into this week's headlines. VW supports Ubuntu pathways in community upliftment projects. Canon Student Development Program launches for 2022. Free spectacles for 80 children in Pietermaritzburg. In line with its priorities of empowering communities through education, youth development initiatives, VW has expanded its support of Ubuntu Pathways by providing a vehicle for the organization. Ubuntu Pathways has provided an integrated system of health, education, and social support for 23 years in the community of Zuidwe, empowering youth through various initiatives covering their journey from cradle to career. The new crafter, which will be provided to the organization for a period of 3 years, will be used to transport learners to and from the Ubuntu Pathways premises and to other after-school activities. Canon Europe has launched the Canon Student Development Program for 2022. Now in its 6th year, the program offers invaluable access and exposure to experienced professionals from the photographic community and the opportunity to attend key industry events. The educational program lasts between 6 to 12 months depending on the mentee's progress through the process and is designed to cultivate the next generation of photojournalists by creating a peer-to-peer network for visual storytellers. The program will work with cohorts of international experts to support this year's mentees and provide them with the knowledge and inspiration they need to launch their careers. World Optometry Week was celebrated in style, with 80 children with compromised vision who are unable to afford eye care, each receiving free pair of prescription spectacles thanks to the collaborative joint efforts of Order of St. John and Ster-Kinekor. Since 2018, the eye clinic at the local government Northdale Hospital has been experiencing a critical backlog with their ability to dispense spectacles, such in the demand for eye care for people unable to afford private options. St. John's Eye Clinic in Pietermaritzburg, on hearing about Northdale's predicament, appealed to Ster-Kinekor Proactive Vision Mission CSI project requesting their help. Without hesitation, the team from Vision Mission came on board to support St. John. 30 of the 80 children were treated to a free movie at Watercross Mall in Waterfall to test drive their new spectacles.
Yesterday was the 7th of April and we observed World Health Day. Is there maybe an initiative that the Heart and Stroke Foundation was involved in to commemorate this special day?
Yes, we did have a number of public awareness events because the most important element in our public health events is sharing knowledge about heart and stroke disease, and so that the members of the public understand the context of the risk factors, especially lifestyle choices, and this was one of the main focus. And with World Health Day and the World Health Organization estimating that 13 million people will die because of climate change. And we wanted to link the importance of cardiovascular disease and climate change. And we also looked at the South African context. Heart disease and stroke kills 1 in 6 people, and our health promotions program helps to disseminate very important educational information to empower communities to adopt healthy lifestyles and make changes in behaviors such as quitting smoking, eating healthy, and incorporating physical activity as well. And another very important aspect, Nokatula, is health risk assessments. We conducted health risk assessments for the community, and this is the testings of blood pressure, sugar, cholesterol, so that people know their health status. I think that's very, very important. And those that have these existing conditions can get help in terms of, going back to the healthcare professionals and managing their conditions. And it's also very important because it's early diagnosis in people who have symptoms. So that's a very, very important aspect of our work yesterday as well.
Mm-hmm.
And radio interviews, they play a huge role, an education role in terms of changing lifestyle behavior in communities. And with the radio interviews, it's very important because it also gives us an opportunity for us to speak to people who do not have access to TV or radio, TV or unable to read, so that they are empowered with educational information as well. So very important campaign yesterday and was very, very successful as well.
Great, that's great. Well done on that. So Prof. Pamela Naidu rather speaks of joining hands with governments, health advocates, healthcare professionals, and individuals, etc. Is there maybe a project that the foundation does to deal with specifically the matter of pollution?
Yes, absolutely. There are many risk factors for cardiovascular disease, and we just found that climate change plays a huge role in terms of promoting cardiovascular disease. And we align with national organizations as well as the governments, as well as the World Health Organization, where we promote health as a very fundamental aspect in terms of prevention. And we collaborate with the various organizations so that we are calling for action on various stakeholders to play their part, and also individuals as well, so that we make a difference in heart and brain health.
Is there a relationship between air pollution and CVD?
Yes, environmental exposure is an important risk factor for the development of cardiovascular disease, and the Heart and Stroke Foundation South Africa aims to raise awareness around the link between heart and stroke disease, and climate change or environmental exposure. And the link, it is very important to have a better understanding of how the two are connected. It is the understanding that will encourage the general public to take action against air pollution and how this affects the cardiovascular system. Air pollutants are inhaled into the lungs and get transmitted into the cardiovascular system, and this follows a cardiovascular dysfunction. In other words, it affects the cardiovascular system negatively, right? And this may cause a whole lot of problems because vessels begin to stiffen up, blood pressure can be raised, and this can influence cardiovascular disease.
I had absolutely no idea. This is very informative, actually. So each and every individual is responsible for making sure that they stay healthy. How can this be done? Because there's also the cost aspects attached to it, and someone will say, "Oh, a health check is possibly an expensive thing." So how do we go about it as regular citizens?
Yes, the Heart Foundation encourages everyone to adopt a healthy lifestyle, and healthy lifestyle means eating healthy. In other words, incorporate the foods that are good for you. For example, fruit and veg, lots of whole grain foods, as well as legumes, beans, peas, etc. And I think use salt and sugar sparingly. If you look at salt, excessive intake of salt increases blood pressure. As a result, we end up with strokes as well. So I think that's very important in terms of incorporating healthy lifestyles, and we encourage everybody to know the numbers. In other words, have your blood pressure test, have your glucose tested as well as the cholesterol. And that is why the Heart Foundation does the free screenings in communities, so that people are aware of the numbers and they can make a difference in their heart and brain health.
That's amazing. So shockingly, 10 people suffer a stroke in South Africa every hour. What are the causes? Also, what can be done to prevent it, even if it's genetic?
Yeah, stroke is a condition where the blood supply to the part of the brain is disrupted, resulting in oxygen starvation, brain damage, and loss of function. So, although stroke is a complex medical emergency, there are ways to significantly reduce the incidence of stroke. And we focus on stroke prevention, and there are modifiable risk factors, for example, and we have the power to change. If you look at, for example, smoking, smoking is one of the most important preventable causes of strokes, right? So I think it is important to encourage our public, members of the public, to quit smoking. And if you having difficulty in smoking, try and get some help as well. Speak to somebody, a healthcare professional, so that you quit the habit. And there's no safe level of smoking, all right? And as a result, you can prevent strokes from happening in our community. And then also lifestyle. We spoke about healthy eating. That is important. Also managing stress effectively. I think with so much going on in our lives, with COVID, and we all have to be very careful in terms of managing our stress. And that could be another risk factor as well. And you are quite right. We have family history. You cannot change your family history, all right? This is one of the unmodifiable risk factors. But there are other risk factors that we can change: healthy eating, smoking, managing stress properly, and also incorporating a lot of physical activity. Brisk walking is excellent, and that can they say, exercise is medicine, and that is very true. We can incorporate a few and a healthier way to take care of our heart and our brain as well.
Yeah, well said. And lastly, for more information, how can we access the foundation, or how can the audience access the foundation?
Our audiences can go to our website, which is www.heartfoundation.co.za. They can also follow us on our social handles: Instagram, Twitter, Facebook. And we also got a very interesting health chat line where your audience can call into the office, and the number is 021-422-1586, and they can speak to any one of our professional staff and talk about any of the cardiovascular concerns, whether they are interested in nutrition, heart and stroke disease, healthy recipes, and they can get some valuable information there. And Nokutula, we are an NGO. As a non-government organization, we are reliant on funds, and so that we can expand our work in the under-resourced settings, so that more people are aware of the risk factors for heart and stroke disease and can make a difference as well. So they can also donate funds to the foundation as well.
Welcome back to the Social Network. Every week we feature a game changer who is on a mission to change people's lives. This week's game changer is eCubed. Together with the Basic Department of Education, the eCubed team has identified active learning prodigies and project-based learning in particular as the vehicle to solve the problem of high unemployment and poverty in South Africa. We sat down with James Donald, who is the managing director at eCubed. He tells us more about their partnership with DBE.
Hi, my name is James Donald. I'm the Executive Director of the Department of Basic Education's EQ program, which is for entrepreneurship, employability and education. The EQ program, the Department of Basic Education has been looking for since 2014 at ways to improve preparing young people for a changing world so that they leave school with the skills they need for either entrepreneurship, employability or further education. The way that the EQ program works within the Department of Basic Education is to try and not have additional work for teachers to do in an already challenging curriculum and with the disruption to learning because of the pandemic. So what happens is teachers from grade R all the way through to grade 12 have to do what are called school-based assessments. So those are projects in the third term. They're often projects. And so what the EQ program does is supports teachers to introduce project-based learning. So it's a way of engaging with learners that they get to pursue things that they're interested in. It's much more fun, much more purpose-driven, and very evidence-based. So children can start building the kinds of skills they'll need when they go into the real world when they finish. This for any school in the country is welcome to be involved, and I can share the number of how schools can sign up. But what happens is in life orientation, life skills, and EMS, so in those particular subjects, but it is expanding to others. So to give you an example, there may be within life orientation an opportunity for learners to talk about issues that matter to them, say bullying. So that will be in their existing curriculum. So what happens there is the teachers get given support to be able to run a project where learners can decide for themselves how do they want to find out more about bullying in their school, how might they themselves without even necessarily meaning to, have been responsible for bullying others, and what can they do to change things. So that's already something, as an example, bullying that's written in the curriculum, but within life orientation, the teachers are trained to do a project where the learners really take charge, where they're able to work in small teams, where they're able to iterate and try different things, and where they're able to start working on their own projects and things that they really care about. The Department of Basic Education has a lot of responsibility to look after the learners in South Africa. And I think, like all of us, during the impact of COVID-19, had to try new things and learn and engage differently. So one of the most game-changing components there is called Teacher Connect. So it's a WhatsApp line that the DBE uses. The eCube team is part of DBE, so it's one of the things we're responsible for. But that line during COVID now has more than 160,000 teachers and people supporting teachers that use the number every day. It's pretty easy to remember. It's 060 060 3333. And if you WhatsApp the word hi to that line, teachers can get support, parents can get support, and you can find out more about this initiative. So I think that agile way of working is quite game-changing. And I think we often think of entrepreneurs or game changers as people in business or in technology, but people in government have just as an important a role to figure out new ways of doing things better, to serve our children. And I think the DBE's EQ program is one of a number of examples where our government is taking responsibility for changing things and preparing our learners better for the future. I think the biggest challenge for any teacher is time and demands. So teachers are often in environments where they have more than 40 learners in their classroom, where they have lots of different competing demands for their time. So the perception of having to do yet another new thing or yet another additional thing can be overwhelming for teachers. And when teachers realize that this initiative is not asking them to do anything new, but rather helping them achieve something they already have to do, which are these school-based assessments, but in a way that's fun and engaging for the learners. So it helps them improve classroom engagement, it helps them learn different ways to do classroom management. So I think that experience is really, really helping. For anybody who, you have a dinner conversation and people tend to get disheartened. We know that the world is changing. The demands on each of us in our workspace is different. And we're starting to say that South Africa should be doing more to prepare children for the future. And just to encourage people to realize that you can do things today already in order to make that difference. And that really preparing ourselves for the future is far more about being more human and less robotic. So learning how to handle relationships, learning how to manage yourself. And in fact, using things like project-based learning are a really fun and engaging way to bring a number of elements to the classroom. So we work with the Lego Foundation, for example, and we use learning through play in the younger grades because play is all about iteration and purpose and social engagement, which are the things we'll need in the workplace. So look us up on that number, 060 060 3333, and encourage teachers and parents that you work with to get involved.
Unfortunately, we have come to the end of our show. For more information on these stories, visit www.socialtv.co.za. From me, Amanda Mkhize, till next time.